Good day everyone, we are Group 8 and today we will be presenting about the Department of Health Administrative Order number 2017-0012, also known as the Guidelines on the Adoption of Baseline Primary Health Care Guarantees for All Filipinos. Before we begin, let me introduce my group members, Pia Morales and Shell Balios. So now, let's begin. So, this administrative order was issued by the Department of Health to strengthen the country's primary healthcare system. It aims to ensure that every Filipino has access to first contact, accessible, continuous, comprehensive, and coordinated healthcare services. Through this order, the DOH envisioned a health system where no Filipino is left behind in receiving quality and affordable health care. Now that I have introduced the essence of Administrative Order number 2017-0012 and its goal of providing baseline primary health care for all Filipinos, let's move on to a deeper understanding of how this mandate connects to nursing informatics, one of the key components that support effective and efficient primary healthcare delivery. Next slide, please. So now let's answer the question, how does the mandate for first contact, accessible, continued, comprehensive, and coordinated care under EO 2017-0012 make nursing informatics an essential component of primary healthcare delivery? So, the mandate emphasizes that primary healthcare should be the first point of contact for every Filipino, ensuring that care is accessible, continuous, comprehensive, and well coordinated. To achieve this, nursing informatics plays a vital role. Nursing informatics integrates nursing science, computer science, and information technology to manage and communicate data, information, and knowledge in nursing practice in the context of EO 2017-0012. It helps nurses document and track patient information efficiently, supporting continuity of care, facilitate communication between different health providers for coordinated services, use electronic health records, which is EHRS, to monitor population health and identify priority cases, and improve accessibility by enabling digital health solutions such as telehealth and mobile health applications. In short, nursing informatics ensure that healthcare delivered under EO 2017-0012 is data-driven, patient-centered, and efficient, helping achieve the DOH goal of universal health care for all Filipinos. So that's all for my topic. So for the next topic, I will call Miss Pia Morales to tackle that. Thank you.
For my part, I'm going to discuss the Administrative Order 2017-0012, requiring a monitoring and evaluation system for the health guarantees. The purpose of this is to check if these health guarantees are really being delivered. This is where data management and analysis skills come in. So how does this requirement create a need for data management and analysis skills in nursing informatics? Imagine if we have thousands of patients across different regions without proper data recording and analysis. It would be very hard to know if people are actually receiving the services they need. Nursing informatics helps organize patient records, track outcomes, and generate reports that guide decision making. Next is the circular outline specific population-based and individual-based health services for different life stages. So the circular lists both population-based services like immunization programs, health education, and disease prevention, and individual-based services which include personal consultations, treatments, and maternal or child care. These services also change depending on a person's life stage from childhood to old age. So, how does nursing informatics help in the delivery and tracking of these services? Nursing informatics helps by creating systems that can track who has received what service, at what age, and when the next service is due. For example, electronic health records can remind health workers if a child is due for a vaccine or if an elderly patient needs regular checkups. This makes delivery more organized and prevents people from being left out. So overall, Administrative Order 2017-0012 highlights the need for nursing informatics as a bridge between health guarantees and actual patient outcomes. It turns raw data into useful information that supports both individual care and community-wide health programs. Next is the circular outline specific population-based and individual-based health services for different life stages. So the circular lists both population-based services like immunization programs, health education, and disease prevention, and individual-based services which include personal consultations, treatments, and maternal or child care. These services also change depending on a person's life stage from childhood to old age. So, how does nursing informatics help in the delivery and tracking of these services? Nursing informatics helps by creating systems that can track who has received what service, at what age, and when the next service is due. For example, electronic health records can remind health workers if a child is due for a vaccine or if an elderly patient needs regular checkups. This makes delivery more organized and prevents people from being left out. So overall, Administrative Order 2017-0012 highlights the need for nursing informatics as a bridge between health guarantees and actual patient outcomes. It turns raw data into useful information that supports both individual care and community-wide health programs.
Good day, everyone. I am Shell, and today I will be talking about the ethical and legal challenges in data management under DOH AO of 2017-0012. So, under the DOH Administrative Order of 2017-0012, nurses play a crucial role in gathering and submitting patients' data to a centralized health information system. However, this process raises several ethical and legal challenges. First, patient confidentiality must always be upheld, and nurses must ensure that sensitive information is shared only with authorized personnel and used strictly for healthcare purposes. Second, informed consent becomes an ethical concern. Patients should be aware of how their data will be collected, stored, and used. Third, data accuracy and accountability are vital, as any error in input can affect patient care outcomes and policy decisions. And finally, nurses must comply with the Data Privacy Act of 2012 RA 10173, which mandates strict standards for data protection. Balancing transparency for health improvement with respect for patients' rights is the core challenge of this mandate. So now moving on to the impact of AO 2017-0012 and the UHC Act on Nursing Development and Education. So the combination of DOH AO 2017-0012 and the Universal Healthcare Act RA 11223 has significantly transformed nursing practice and education in the Philippines. These policies emphasizes data-driven and patient-centered care, which has led to the integration of nursing informatics into nursing curricula and continuing education programs. Nurses are now expected to be proficient not only in clinical care, but also in data management, analysis, and technology used to support decision-making and improve service delivery. Moreover, this framework encourages lifelong learning and empowers nurses to engage in policy formulation and health system strengthening. In summary, these laws foster a new generation of nurses who are both technologically competent and socially responsive, aligning their skills with the goals of universal health care. Thank you.